So the typical stages when somebody is first found to have a lesion that has raised alarms as potentially being a malignancy partly depends on the cancer itself. So again, we'll go to the lung cancer patient, but this would not necessarily be any different for a whole lot of other cancers. A chest x-ray is done and the radiologist reports a small lesion or an abnormality is identified. The radiologist suggests to the family doctor that a CT scan, which is a higher resolution imaging modality, should be undertaken. There's necessarily a few weeks from the communication by report of the abnormal x-ray to the physician's office organizing a CT scan, then booking a CT scan, then getting the CT scan, and then getting a report back from the CT scan. And so unfortunately that sometimes results in a 6 to 8 to 12 week process just to get the CT scan, and that would be consistent with the current paradigm of care. Once the CT scan is done, which then raises the alarm even further because it's a much higher resolution imaging, and now we really believe they have a cancer, the patient would then generally be referred to either a respirologist, perhaps an oncologist, depending on the community where the patient lived, or even a thoracic surgeon. Any one of those would then necessarily increase their interest in doing more tests to, one, diagnose the cancer, that is, confirm that it is a cancer, and then two, simultaneously staging it. And what that means is we want to know, is this an early tumor? Is it becoming a more advanced tumor? Has it spread anywhere? Is it still amenable to cure with surgery? Do we have to treat with radiation or chemotherapy first? Or is it even curable if it's already advanced to a stage 4 disease where it's spread? And so those are the challenges or the responsibilities of the next referring physician. If the respirologist sees them and does a bronchoscopy, which is a scope into the airway, and they take samples and find evidence of cancer, then they would refer them to a thoracic surgeon or an oncologist, depending on what stage they found the patient to be at. So it's a very dynamic process from the time the first imaging is done until they get to the point where somebody can say, okay, I have a definitive treatment plan for you. And it can unfortunately be quite delayed because of the number of professionals or specialists that are necessarily involved in that whole pathway, coupled with all of the tests that need to be done. It can add up to a couple of months. Fortunately, most of the time that probably doesn't come to bear on the patient's prognosis or ability to cure them, but it's a long couple of months for most patients.